This is a clamshell exercise, actually two exercises. We are going to do an external rotation clamshell, meaning opening the hip, that's external rotation. Then we are also going to do a variation where we internally rotate the hip like this. So meaning foot out, knee is in, that internally rotates the hip. So the first variation, you're going to lie down on your side. You have a ball. We're going to do a ball press with this. For this external rotation variation, we want this top leg shifted forward, so the top knee should be in front of the bottom knee. Okay, that's going to help use the glutes a little bit better here. So then as you exhale, you're going to press into the ball, activate your lower abs, and then open up that hip. Again, keeping that top knee in front of the bottom one. So inhale through your nose, exhale, draw lower abdomen inwards, and then open through that top hip. You can also place something like a yoga block behind you to keep you from rotating backwards like this. That's cheating, so that can be a good cue. I learned this from Mama Stay Fit. They have a lot of pregnancy and postpartum training programs and just have great education. So that is where I learned this exercise and those tips from. The second variation is having the band around your ankles with a yoga block between your knees. Same thing, we were doing the ball press too. So this time, instead of the top knee forward, you want the top hip shifted back. So think of kind of like shifting that hip back and straight back in the socket, like the hip crease here is coming back. Okay, so then with keeping that position, then you are going to bring the band apart. Okay, so you're pulling your foot up against the resistance of the band as you press into the ball. Okay, so remember, check in with yourself, shift that hip back, inhale, exhale, check in, make sure you're shifting that hip crease back, inhale, exhale, so that is internal rotation, and then before we did external rotation. So do both ways, and we want to do both sides. So maybe try about 10 reps to start for each exercise and do both sides as well. Make sure if something doesn't feel right in your hip, just check in, make sure for the internal rotation you're shifting that hip back, and for the external rotation, make sure you're shifting that top leg forward. That can help if you're having any discomfort. But again, please reach out with questions because you should not be experiencing pain or discomfort with this exercise.